Amphotericin B is an antifungal medication used for serious fungal infections and leishmaniasis. The fungal infections it is used to treat include aspergillosis, blastomycosis, candidiasis, coccidioidomycosis, and cryptococcosis. For certain infections it is given with flucytosine. It is typically given by injection into a vein. Common side effects include a reaction with fever, chills, and headaches soon after the medication is given, as well as kidney problems, allergic symptoms including anaphylaxis miaca. Other serious side effects include low blood potassium and inflammation of the heart. It appears to be relatively safe in pregnancy. There is a lipid formulation that has a lower risk of side effects. It is in the polyene class of medications and works in part by interfering with the cell membrane of the fungus. Amphotericin B was isolated from Streptomyces nodosus in 1955 and came into medical use in 1958. It is on the World Health Organization's list of essential medicines, the safest and most effective medicines needed in a health system. It is available as a generic medication. The cost in the developing world of a course of treatment as of 2010 is between $162 and $229. One of the main uses of amphotericin B is treating a wide range of systemic fungal infections. Due to its extensive side effects, it is often reserved for severe infections in critically ill or immunocompromised patients. It is considered first-line therapy for invasive mucormycosis infections, cryptococcal meningitis, and certain aspergillus and candidal infections. It has been a highly effective drug for over 50 years in large part because it has a low incidence of drug resistance in the pathogens it treats. This is because amphotericin B resistance requires sacrifices on the part of the pathogen that make it susceptible to the host environment and too weak to cause infection. Amphotericin B is used for life-threatening protozoan infections such as visceral leishmaniasis and primary amoebic meningoencephalitis. The following table shows the amphotericin B susceptibility for a selection of medically important fungi. Mic breakpoint amphotericin B alone is insoluble in normal saline at a pH of 7. Therefore, several formulations have been devised to improve its intravenous bioavailability. Lipid-based formulations of amphotericin B are no more effective than conventional formulations, although there is some evidence that lipid-based formulations may be better tolerated by patients and may have fewer adverse effects. The original formulation uses sodium deoxycholate to improve solubility. Amphotericin B deoxycholate is administered intravenously. As the original formulation of amphotericin, it is often referred to as conventional amphotericin. In order to improve the tolerability of amphotericin and reduce toxicity, several lipid formulations have been developed. Liposomal formulations have been found to have less renal toxicity than deoxycholate and fewer infusion-related reactions. They are more expensive than amphotericin B deoxycholate. Ambisome is a liposomal formulation of amphotericin B for injection and consists of a mixture of phosphatidylcholine, cholesterol and disteroyl phosphatidylglycerol that in aqueous media spontaneously arrange into unilamellar vesicles that contain amphotericin B. It was developed by Nexta Pharmaceuticals. It was approved by the FDA in 1997. It is marketed by Gilead in Europe and licensed to Astellas Pharma for marketing in the US and Sumitomo Pharmaceuticals in Japan. Fungicim is a generic liposomal complex of amphotericin B marketed by Lifecare Innovations of India. Amphotericin is available in by Abbott India brand name Fungazone INJ in 50 mg 367 rupees per vial and many other also like Amphi by Intas 2990 and Lambin by Sun Pharma 4457 etc. All are injection A. Number of lipid complex preparations are also available. Abelsit was approved by the FDA in 1995. It consists of amphotericin B and two lipids in a 1:1 ratio that form large ribbon-like structures. Amphotericin is a complex of amphotericin and sodium cholesterol sulfate in a 1:1 ratio. Two molecules of each form a tetramer that aggregate into spiral arms on a disc-like complex. It was approved by the FDA in 1996. An oral preparation exists but is not widely available. The amphipathic nature of amphotericin along with its low solubility and permeability has posed major hurdles for oral administration given its low bioavailability. In the past it had been used for fungal infections of the surface of the GI tract such as thrush, but has been replaced by other antifungals such as nystatin and fluconazole. However, recently novel nanoparticulate drug delivery systems such as ambi-on nanosuspensions, lipid-based drug delivery systems including cochleates, self-emulsifying drug delivery systems, solid lipid nanoparticles and polymeric nanoparticles, such as amphotericin B in pegylated polylactide coglycolide copolymer nanoparticles, have the